You're back.
Good?
Yeah, I think so.
Well, we have just been spending the last 20 minutes or so in a discussion of questions of postpartum questions, which will be covered at a later time. This is just for you, Dina. I'm saying this. But now to continue, I wanted to go ahead and start talking about the stages of labor and what's happening. And I'm so bummed I don't have my pelvic model to kind of, I'll bring visuals next time. How familiar are you guys with stages of labor? Because I know you covered some of this like in your medical training.
Yeah, I don't remember very much.
I have like no knowledge. She didn't like.
You guys see the tape?
Remember the names?
What's that?
You see the tape?
Oh, right here.
Okay.
Another piece.
Thank you. Okay, so why don't we start with a little icebreaker activity. Actually, no, I'm going to hold off. I have a very fun demonstration I'm going to get you guys to do, but I want to do it after we talk about a little overview of the stages of labor and what's happening in your body during each stage. Then we're going to go back and we're going to talk about those stages again, but more in depth. And we're going to talk about what to do during each stage without getting into like the really deep comfort measures stuff. So, and we'll talk about what Janine should do and then what Dan can do to support Janine.
Okay.
So labor is divided into 3 stages. So stage 1 is basically the dilation stage. So dilation, you know what I'm talking about, Dan. This is right when we go from 1 to 10 centimeters. All the contraction, everything everybody thinks of as labor, we're going to call it stage 1. Okay? Stage 2 is the pushing stage. That's when the baby actually descends down the birth canal and is born. And then we have stage 3, which is the placental stage. That's when the placenta comes out after birth. A lot of people don't know you actually have contractions after the baby's born.
Birth of the placenta.
Oh, really?
Yeah.
Yeah. Did you know that?
I didn't know that. No.
This is why I need my
Well-
models. I've got to demonstrate the placenta.
You know what dilation refers to, like the cervix? Or
Yeah. Oh, I knew there was a placenta, but I didn't know when it came out, I guess. So.
Yeah. So right now, inside the womb, as it's growing, the body actually forms an organ. It's like the only time in a person's life that you actually form an organ and grow it as an adult. And it's inside, so that the uterus, which is inside, above the vagina is the uterus, which is right now where the baby is growing. And that's what we call the womb. And the womb is growing, and it's at my house too. The placenta is an organ that is attached. I'm a really bad artist, but let's say, okay, this is the womb or the uterus. This is the cervix. So this is like the opening to the uterus, and this is the vagina. So the baby right now is in here and is attached by the umbilical cord to this organ that attaches to the wall of the womb.
Looks like a
Banana.
You know, the placenta kind of does look like a jellyfish, actually. And so right now, as Janine is growing this baby, her body is taking nutrient. It's actually the placenta. The placenta is amazing. It does a million things, but it pulls nutrients out of Janine's body and it delivers them through the umbilical cord to the growing fetus. And as the fetus grows, it continues. And so the baby is in this amniotic fluid here, and they're getting all of their oxygen. It's like an aquatic animal right now. It's getting all of its oxygen, all of its nutrients through the placenta. And so after the baby comes out, so does the placenta. And you can actually see it. It's pretty cool. And they're pretty big.
Like some cultures like bury it, right? Like they keep it and bury it.
Yeah, I'm sure there's lots of tribal things women do. I don't know. I know that one big thing that's even growing in the United States is what's called placental encapsulation. Have you ever heard of that?
I haven't heard of that.
People keep the placenta, and then they have placental encapsulators that might freeze dry them and grind them and put them in capsules to take after birth, because it increases your iron levels. And it's kind of big in the birth world, but when I first heard of it, I was like, what? Some people, maybe on the more crunchy side of things, put it in their freezer and like make smoothies out of it. But it's pretty cool. Your body has an organ that is like just during pregnancy, and then it goes away. And this is, I mean, it's several pounds. It's quite a big organ.
Wow.
Yeah. So I don't have like all the developmental stages here, and you can see that I'm not a good enough artist to do that for you right now. But yeah. So we're talking about dilation. We're talking about the cervix going from 1 centimeter to 2 centimeters all the way to like. Let's see. This is not accurate. Not drawn to scale. Okay. The cervix, or the entrance of the uterus, is opening to 10 centimeters during the dilation stage. And the baby cannot begin to descend down the birth canal until we get to 10 centimeters.
So there's like the dilation and then the effacement too, right?
Yeah, so 3 words to know are ripen. So ripen means to soften. The cervix has got, it's right now, it's very, the mouth of the uterus is very thick. It's got to ripen, then it's got to efface, which is to thin out. So ripen, efface, and dilate are 3 words that we'll kind of use in here. The ripening and effacement typically happens before labor, or in the early stages of labor. So dilation, the main stage of labor, is divided into different parts. So, and I'm going through so much more paper than I expected to go through here. Oh, and I need more tape. I should just keep the tape over here. I really need one of those, the stands that you put the paper on.
Right.
But I borrowed this from River today. Okay, so the dilation stage, or stage 1 of labor, is divided into, we'll say, pre-labor, early labor, active labor, and then we'll have an intermittent stage called transition. Okay, so pre-labor. Pre-labor is before you're really in labor. There's a lot of things that your body has to do to gear up and prepare. So there's some things you might notice when you're, in the, let's say 39, 40 weeks, and you're thinking, oh, it's going to happen in time, or even as early as 37 weeks, you may notice some changes in your body. Do you want to guess what any of those are?
I don't know.
Well, first of all, you'll notice that the baby engages in the pelvis. So what we call engagement is when the baby lowers down.
Oh, is that
in
like
your
the
pelvis.
plus 4 through Sarah? Or is
Yeah,
that,
they
is that
might-
different?
That's called the baby station,
Okay.
and it does have to deal with the baby station. Yeah, so the baby is moving lower
Okay.
down. You'll notice a drop like your belly, which right now, you see it up here, begins to be
Oh,
a little bit lower.
Okay.
Because the head is actually going down into the pelvis to gear up for birth. And sometimes they call it lightning. I think they call it lightning because suddenly your lungs, which are so compressed, now feel a little bit lighter. You can breathe. You'll also notice that you might lose your mucus plug. So the mucus plug, in our last you saw the cervix, there's a little plug of mucus basically that is covering up the entrance to that cervix. So before, as you begin to, the cervix begins to ripen in the face, that plug may come out. So you might just notice, like in your underwear or in the toilet, or you might not notice it at all, or you might see some bleeding. You just want to make sure that that bleeding is not more than like a tablespoon, but a little bit of
Is
blood.
that what they're called, the bloody show?
Yeah. Yeah. So the bloody show also has to do with the losing of the mucus plug.
Okay.
So it may look mucusy or it may look a little bit bloody. That's very normal. And that's probably going to happen it can happen a few days, to even a couple weeks before labor really starts. Okay, Dan? Okay, you might notice some irregular contractions. So these are like your Braxton Hicks. So, and they might feel like contractions, but they're not getting stronger. They're just kind of, they might come for a while and then stop for a while. Start and stop, or not really getting stronger in intensity. They're typically not painful, they're just noticeable. You can kind of notice the difference between a Braxton Hicks contraction and the real thing. Often the real thing starts with a backache and feels kind of like a menstrual cramp when it first begins, whereas a Braxton contraction typically feels, you feel it like in a part. It doesn't wrap around or have back pain associated with it. As a very general rule. Also, in this stage, what's happening is ripening and effacement. So you may not see it happening, you won't know it's happening, but that cervix is getting smaller and smaller and thinner and thinner. Now, I really wish I had my fetal model, but what begins to happen somewhere between early labor and pre-labor, as the body gears up, the head descends, and this is station, this is what we're talking about. The baby gets to 0 station is when the baby's head is directly in between those ischial spines of the pelvis. And that's 0 station. So they kind of can tell where the baby's at. Station like +1, +2 is when the baby's above the spines, and like negative is when the baby's actually beginning to descend lower into that. But what happens as labor begins is that head puts pressure, the baby's head puts pressure on the cervix, and it triggers a hormonal response. And this goes up to the brain, and it triggers the body's release of oxytocin, which is what begins contractions. But as the baby puts pressure on the cervix, prostaglandins are released. And so it's called a positive feedback mechanism, because the more pressure that head puts on the cervix, the stronger those contractions are going to get. And it's interesting because you can imagine how much positioning has to do with this, right? If you're standing and you're in a horizontal position and having gravity is helping you,
Right.
you can imagine how that's going to help that positive feedback mechanism versus lying on your back.
Right.
Then you don't have the added benefit of gravity. So that is what triggers labor. Labor begins when your brain releases oxytocin and contractions begin. So,
And that's so you would most likely be, or you should be at 0 when you go to the hospital. Like, because you would, that's when the real contractions start, right?
You'll see as we get into, I would say active is where you go to the hospital.
Okay.
So this is all pre-labor,
Okay.
but now baby's head is putting pressure on the cervix. Early labor begins. Okay, so in early labor, contractions now begin to be a little bit more regular. So I'm going to put regular contractions. They pick up a little bit of intensity. So here, contractions can be anywhere from 20 minutes or less apart, and they can last anywhere from 30 to 45 seconds. And later we'll talk about how to time them, okay? So, pretty far apart, you get a lot of rest in between contractions. Contractions, you can feel them, but they're not super painful yet. At this stage in early labor, you usually become fully ripened and effaced, and dilation is beginning. So early labor is when a woman dilates from anywhere from like 1 to 5 centimeters, or some people say 1 to 6 centimeters. The birth world debates about this, but it's when dilation is just beginning.
Okay.
So that's like halfway. A woman typically in early labor, like you're having some pain, but you can distract. She can carry on a conversation. There's huge variation in how long early labor lasts. It can, for some women, can go on for days. I think the average is around 24 hours for a first-time mother. But again, it's not super intense.
Okay.
So this one, when you said your sister was in labor for 55 hours, I'm like, how much of that was here? And she was like, thinking it was really intense.
Okay.
I highly doubt she was here for 55 hours.
Yeah.
20 minutes of 30 to 35 seconds.
Okay, so contraction could be anywhere around 20, probably anywhere from like 7 or 8 minutes apart to 20 minutes apart.
Oh, that's how.
The point is,
Far
are
apart,
they,
yeah.
far apart between contractions, not
Okay.
not that it lasts for 20 minutes. We all wish early labor only lasted 20 minutes, but it lasts longer than that. But you can see, and the contractions are short. But you know the difference between early labor and pre-labor, because here in pre-labor, contractions are very irregular. There's no established pattern. But when you begin to establish a pattern and you know those contractions, they're not going away, you've begun early labor. So you can be confident your body is doing something, even when it feels like it's going on forever. You might feel, what do you think you might be feeling in this stage in early labor? What are some emotions the mother might be facing?
Probably I would be excited and afraid.
Yes, excitement, fear, anticipation.
Yeah.
You're kind of come on now, any day now. You might
Right.
want to be rushing it in your mind.
So this could be several days or weeks. But what about pre-labor? Like how long before the actual birth would that start? Would you say?
This can go on for weeks. Like I've had women, I've known women who've lost their mucus plug and went into labor 2 days later, which is pretty normal, or a week or 2 weeks later.
Okay.
You don't typically notice all of these signs. This is just knowing that your body is doing something. Sometimes it's very obvious, and sometimes it's not.
Mm.
And remember, as we talk about what is normal labor, we can kind of point out the average, but normal is all over the spectrum.
Mm.
You will know where you're at just by some signs that will show you. So when you feel you're here in early labor, but you have established that you are having regular contractions, you're playing a mind game, because you know it can go on for a long time.
Mm.
That comes more in the what to do section. But it can last a while. So you know that you're feeling excitement and fear. But prepare yourself for the long haul. This is not a sprint. This is a marathon. And how we prepare our body for that marathon, we pace ourselves. So that's early labor. So if early labor is 1 to 5, what do you think active labor is in terms of centimeter dilation?
6 to 10.
So active labor is like 6 to 10. Now transition is a part of active labor when you go from 8 to 10 centimeters. We'll talk about in just a minute. So active labor differs from early labor because suddenly, now the woman in early labor, she might be fearful, she might have to breathe, you might notice during a contraction, she's starting to get a little bit more serious. She's not She's not talking as much. But you can distract her. You can hold a conversation with her between contractions. When you get to active labor, that woman does not want to talk. We typically don't want the lights on. She may want music or she may not, but any extraneous conversation, and she's going to tell you to shut up. She is focused. A big signpost of when you're in active labor is the woman is serious, focused. Because now these contractions are intense. It's no longer like, okay, I don't want to this there. It's the real deal is on now. And so these contractions are 5 minutes or less apart. So they come every 5 minutes or less, and they last anywhere from, around a minute. I mean, again, it varies widely, but long enough, you're having to breathe, you're having to use your comfort measures. This is also in the handout I gave you, so if my numbers aren't exactly correct, go look back at the handout I gave you. But they're no longer are they really spaced out. You have time in between each contraction to breathe and time to focus. The pain is not constant. It's a good thing to know about labor is the pain comes and the pain goes. And as doulas and educators, we tell you, one contraction. Let's just get through one more contraction. You can do it. We give a lot of encouragement. Just one more. Focus on the present. Don't worry about, but I can't do this for another hour. I can't do it. Yes, you can. You can do this one more contraction. Look at me. Breathe with me. One more. And because at this point, they're pretty intense. But you can, again, use space. Use space to relax between the contractions. And again, and here, as far as time limits, women usually, and this is the average of which they've kind of based things on, dilate 1 centimeter per hour. So this can go on, you see, from, 4 or 5 hours. Is about average.
That's why they want. Okay, I see.
Mm-hmm.
So if you come too early, like preferably they'd want you to go back home, or.
Right,
Okay.
they would, yeah. And it's good because home is your safe place, the place that you're most comfortable. And again, we want that oxytocin flowing. We want you to feel comfortable and safe. All the bright lights, rushing labor. When's it going to start? The doctors, the nurses, they're waiting on me. That is not going to help get labor going. It's all a mind game. So hopefully, if you're early and you have no high risk factors, they will send you home. But if you come in and you're like 3 centimeters dilated and your things are picking up, they might not. So it really depends on your doctor, depends on how far you live from the hospital. There's a lot of factors. But it's good to know, okay, what are active labor contractions like and what's the body doing? The body's dilating now from 6 to 10. It is totally doable to do this without pain medication. But we get good at knowing some comfort measures and some ways to kind of help relieve that pain, because it is difficult. It's very serious. I remember having some women that, I remember one woman in particular, she was so focused and in the zone. I actually it was like my second doula job ever, and I was a little afraid for her because she was so in the zone, I didn't think she could hear me at all. I thought she was unconscious. She was like, oh. I was like, Gopisa, you want to change positions? She didn't look at me. The only way that I knew that she was like still kind of there was one, there's noises she was making too, like she would just reach out, touch me every now and then, squeeze my hand. But she was like, she's very, very focused. Now, active labor goes all the way to 10 before the pushing stage, but somewhere around 8 centimeters you have what's called transition. These contractions are copable. When you get to 8 to 10 centimeters, this usually only lasts for, it can last up to 2 hours, or it can just last half an hour. This is the shortest and most intense stage of labor, transition. And transition is no joke.
Oh, is that when you said, like, that's usually when people want the epidural, but it's too late?
Yeah. Yes.
Wow.
So if you're one of those women who've prepared and you've got, you've got all your coping mechanisms and you've been so calm and serene, but suddenly you're like screaming, and you're like, "Give me epidural!" Then we know, oh, she's in transition. She's about to push. It's very short. There's actually a lot of other signs that happens in the body, like hot flashes. You'll start to feel hot and cold. You might rip your clothes off if you're still wearing clothes at that point.
That's true.
You could vomit. Nausea and vomiting is very common. Irritability. Janine might have been so sweet up to this point, but she might just slap your hand away and get away. She might like freak out on you a little bit. And Dan, this is the part where you might feel really overwhelmed being beside her, because it is hard to. Chris tells me it's very hard to watch that, to watch her in that level of pain. You need to know that this is normal. You need to know that this means that her body is doing exactly what her body is supposed to do. This means that she's about to push. So you might have a heavy show also. You might start bleeding a lot. If it's too much, like the doctor will come, but like it's normal to have a show, to bleed a little bit, because now the cervix is really opening up, it's fully dilated. And contractions at this point last 60 to 90 seconds with a little break in between. And you might feel rectal pressure, like a lot of women when they get to transition will say that they feel like they have to have a bowel movement. And that's because as the baby puts pressure on that cervix, it's also putting pressure on the rectal muscles. And interestingly, those pelvic floor muscles, the same muscles that control bowel movement, are also what control pushing out the baby.
Oh yeah, I've heard of that.
Yeah.
I hope that's not me.
It might happen. It's okay. You might pass some bowel movement. You won't notice, and there's always this was like one of my fears too, but there's always like one of those hospital pads under you so that they just clean it right up and you don't even know.
Okay, I guess you wouldn't be thinking about that.
You don't care.
Yeah.
And I was very afraid. This was my fear in transition. I was like, I'm gonna lose my modesty. I don't want to be naked. And my childbirth educator was just like, I don't think you're gonna care. And I was like, I've got my clothes picked out. I've got, this is my birth dress. And she's like, okay. And you better believe when I hit transition, I was ripping off clothes, and you're naked and you don't care. Nothing matters. Nothing matters. You're focused. All you can do is get through the contraction. It's very intense, but also, no, it's normal. And it's almost relieving. When you can recognize that you're in transition, it helps you cope with the pain, because again, it's a mental game. And you're like, oh, we're almost there.
Final stretch.
Yeah. Any questions about that?
That's helpful.
So this, again, we're going to go back through and we're going to talk about what are ways you can cope with each of these stages. But this is just a very big overview of what's happening in your body and what might you feel at these stages. So this is this. Now, somewhere at transition, you're going to hear your OB or your midwife call out, you're dilated, you can push. Or you might just start pushing. It really is involuntary.
Oh right, they only let you push at a certain time too, right?
They let you push when you're 10 centimeters dilated.
Okay.
If you feel the urge to push much before that, they might tell you to try not to, because there is like a risk to the cervix if you push. But typically, your body knows what it's doing. Like when you feel the urge to push, you can't. Once the baby is really there and it's really time to push, you can't really hold it back or control it. And the difference is, if you have an epidural, then you may not be able to feel the push as well, and you might have to use directed pushing. So
That would be so weird.
directed pushing, it's like you're on a fetal monitor too, so they can kind of see when the contraction's peaking. Sometimes the epidural is turned down or turned off so that you can push, in which case you can feel it. But if if the epidural, for some reason, is still blocking things, then they will coach you. All right, now it's time to push. Give me 1, 2, 3, and they'll count you through it. They typically don't use directed pushing unless you have an epidural, because your body knows what it's doing. And following your body's natural lead, there's much less chance of fetal distress if you just let your body push when you need to push. If you're overwhelmed or for some reason you're scared, you're anxious or hyperventilating, like they also can coach you through like breathing. Sometimes they'll do what's called the take charge routine. Somewhere between transition and pushing, when you feel really overwhelmed, you may lose your rhythm, you may suddenly you're just like, I can't do it, you know, and they'll get on your level and say, Janine, look at me. One more contraction, okay? Breathe. And they'll look at you in the eyes and they'll hold you and they'll do the take charge routine to help you get back your focus. So if you're feeling scared and overwhelmed. So then it'll be really relieving. You'll be like, and you're there. You know you've made it through the hardest part, which is transition. Pushing contractions, it's intense when you push. It takes your whole body. It takes every muscle of your body. It will be unlike anything you've ever felt before. But somehow I still don't think it's quite as hard as transition usually. And there's more of a rest between the contractions. That's kind of what's hard here is you don't really get much of a break between contractions. But a lot of people in the pushing stage experience a short rest phase. So it can be up to 30 minutes to even longer where contractions stop for a little while. And depending on your provider, they might consider that a problem. And they might recommend doing something to augment that pushing and speed things along. If someone that takes more of an expectant management approach, and they're doing fetal monitoring sometimes, so they know they can monitor the baby's heartbeat. But if nothing's wrong with the baby's heartbeat, but you stopped having contractions, then we call that the resting phase. And what that is, it's a chance for your body to kind of catch up. You know, there's a lot of things that are happening in your body. Your body's having to produce a lot more blood, to use a lot more energy, and your body may take a necessary rest before you start pushing. So just know that, so you don't freak out and you're like, where did my contractions go?
So you go from intense pain to resting?
Mm-hmm. I mean, you're not like, all right, I'm just gonna take a nap now. You know? But either contractions are more spaced out.
Interesting.
Yeah, you have a chance to kind of catch your breath before the intensity of the pushing.
Okay. Huh.
Yeah, it's kind of nice that nature did that for us.
Yeah. Break.
And you typically hear a woman is very out of it, very much, like I said, can feel overwhelmed. You know, it's like a hormonal rush. You cannot. Yeah, I don't know how to describe it, but you're not very coherent in transition. But when you get to pushing stage, you kind of feel a little bit more coherent. You're like, okay, I can do this. It's like a renewed mental energy, because then you know you're about to meet your baby. And you might feel, what do you think you might feel emotionally when you get to the pushing stage?
Maybe elated.
Yeah, elation, that's what I was thinking, that word.
Awaiting next life.
Yeah.
Yeah, relief. You might get back to, here you've just been maybe you've been overwhelmed, maybe now that you're back to excitement. You might, if your pushing stage is a long time, you might feel exhausted and discouraged. And there's where, it's good to know this pushing stage can last a few hours. Hopefully not. And there's where also good positioning, using positioning to help you is actually a big deal. And this is where I think where midwives excel, because the typical way to give birth, and this was a question Janine brought up before we met, is what positions can I give birth in? The typical way in a hospital is, on your back with your feet in the air, which doesn't use gravity at all. But someone that takes a more expectant approach, midwives typically don't encourage that position, or they might modify it so that you're sitting up and you're using gravity, or you're squatting on the bed, or sitting on a birth ball. We'll cover all of these positions, but that positioning also can help shorten the time that you push. It can be exhausting. It also can be super fast. This varies so much person to person. Like Evie, 4 pushes.
Really?
Wow.
Really. And she came out and she like couldn't breathe at first because like she may have swallowed some of the fluid in the like very quick process of pushing. So it's almost, sometimes quick can be traumatic, but yeah, with her, I went from 6 to 10 to pushing like in one contraction.
What?
I mean, that's what I said, there really is no normal. So I was feeling really overwhelmed, and I was told that I was 6 centimeters, but I was like getting to here, and I was getting where I was like, I can't handle it, get me the epidural. And she's like, I had a really good midwife who read the signs of transition. She's like, she's 6, but she's not acting like a 6. So she checked, and as she was checking my contraction, I like dilated to 10.
Wow.
And a few pushes later, like, Chris says it was longer than I remember, but for me it felt like maybe
Same
4
thing.
contractions,
Wow.
something like that. He says it was like 15 minutes, but you know, you can't think, and we'll go over more of what to do, but you can't think, okay, I'm here, so I know it's still going to be a few hours. You never know. It can go fast, it can go slow. Labor is completely unpredictable. The only thing that you can know and do is read your signs. Like, how are you feeling? How are you coping? So pushing, that is when the Janine will feel a strong urge to push. And contractions at this point, like the pushing contractions, typically are around 3 to 5 minutes apart. And lasting again 60 to 90 seconds. So it's pretty long, so you can have several pushes in one contraction. And the baby is moving down the birth canal. And don't have my model to demonstrate, but what's happening is the baby flexes, the neck flexion, puts their head as they descend down. They're rotating through the birth canal. Usually one shoulder is born first, and then the rest of the baby. And before the head comes out, you'll experience something called crowning. Do you know about crowning?
Isn't that when the head comes out? Like it's shows up?
Yeah. Right when the head gets to the very opening and vaginal outlet, and
Yeah.
that tissue has to open up, and that's when tearing can happen. Why they do the episiotomy.
Do most people feel that though?
Yeah, they call it the ring of fire.
Oh my gosh.
They call it the ring of fire because it feels, you know how like when you stretch your skin, it can feel burny.
Yeah.
That's what it feels like.
Oh.
But it's very, very quick.
Okay.
And then I'd almost say that when it's over, it's almost like over. Yeah, it's like, it's intense, but it's quick.
Okay.
And also, you can reach down and you can feel the head. And so crowning, it's a very intense moment, but it's also a beautiful moment because you know at that point the baby is coming.
Wow.
So you're not really worried about pain, to be honest.
Mhm.
You know, most women I've heard share their birth stories, they didn't focus on that moment of transition. Of crowning was like the difficult moment. That was like the beautiful moment. The baby was almost here.
Mm.
And you can also, if you're interested and you want to see, you can also hold up a mirror as the baby's coming out. You can like see him or her.
Or her.
Or
We'll
her.
find out.
You're not gonna tell me.
You'll be fascinated by that though. We'll definitely get you a page.
I don't know if I want a mirror. I think it's
You might want to touch your baby. I was in the moment I didn't touch, but anyways. No right or wrong there. And then after the pushing phase comes the placental phase. When the placenta comes out. And usually,
Do you need a new sheet?
yeah, in a minute, thanks.
Okay.
Yeah, in the placental phase, your baby will then now be on your chest, You'll be doing skin to skin, and I know that this is common practice in hospitals, is to put the baby on your skin. It has so many great benefits. It regulates their temperature and their heartbeat, and just imagine what a hard transition it must be for a baby to go from the environment inside the womb to the outside world. And putting the baby skin to skin really helps in a lot of ways. Actually, I have more on that to come, but what will usually happen in the placental stage is you'll be cuddling with your baby and you'll hardly notice the contractions that follow. There will be contractions and they can be uncomfortable. But at this point, it's, you're not too worried about it. You're like having the best moment of your life, enjoying your baby. And your care provider might do some things like put some pressure on your abdomen. But these contractions are nowhere near the intensity of the pushing. And you'll kind of feel when the placenta comes out. And then your provider will check it to make sure that all parts of the placenta came out. Because sometimes, every now and then, a woman can retain part of the placenta, which can be a medical issue. But yeah, that's the placenta stage. Do you have any questions about placenta?
Do they cut the umbilical cord when the baby's born, like right away?
Good question. What do you think, Janine?
I think they wait a little bit because there's no blood in there, right?
Yes. So that I would add to our list of questions you're going to ask your provider is, do you do delayed cord clamping?
And they can also harvest stem cells, right? That's like
Right.
a new thing. Or, I don't know if it's new. It's new to me.
I know, it's new to me too. I'm not sure what the process is for that, but delayed cord clamping is when they wait for the cord to stop pulsing. Right now, until that moment they are born and take their first breath, the baby's getting all of their blood and oxygen through the umbilical cord. And it's proven, like it's evidence-based, that when the baby first comes out, if you wait for the cord to stop pulsing, then they're getting more blood and there's less of a risk of them to have an iron deficiency. And just lots of benefits. So most providers now, standard practice to do delayed cord clamping, but some old school providers might not, and I honestly don't know about the hospitals here. Dina, that's a question for you. I would definitely ask your provider and put it in your birth plan.
Okay.
And know that in those moments you prepared yourself, you know what you want, so you can advocate for yourself in the moment too. Yeah, so cord will be cut. Baby will usually be towel dried. They say not to bathe the baby for like the first few days because they're born with that stuff on their skin called vernix. There's just a lot of evidence that it's good. It provides them immunity. It's supposed to be there, and the best thing to do is to towel dry it off and not to bathe them for the first couple of days. It really is not as icky as it has. It seems icky, but it's really not. They get very clean with a towel. It's almost like lotion. Like they've been protected from the amniotic fluid by this like lotion-like stuff on their skin. And when they come out, you towel them off really well, and it doesn't smell. It's very
Just
normal.
like a barrier.
It's a barrier, and it's protective, and it's got all sorts of antibodies and things from Janine, and it even helps with bonding. So, leave the vernix.
We won't get a baby bath. Alright, what is for?
Yeah, and a few days later, like they say, then you can get your baby back. But I am curious what the practices are in the hospitals here. Yeah.
Do they let the baby stay with you, like after, or just throughout the hospital stay?
That's like a newer thing here.
Really?
Yeah, instead of, well, at least at Einstein Day, that was like a big thing. Like, we let your baby stay with you.
Well, yeah, Nate and Hope were saying
As opposed
that
to the nursery.
yeah, that their baby stayed with them the whole time.
Yeah, which is better.
Again, I don't know about the practices of the hospitals here, but that would be a really good
I
question to ask
definitely
your
want that.
provider.
That would be important.
I know at Lincoln they do allow, at least I read online, so I hope I'm correct. That's what they said on their website. But if you want that, because the more that baby is skin to skin with you, the easier breastfeeding is going to be. And the bonding, and just less crying, and it's a less difficult transition. So I don't know why it's not standard practice at every hospital. It's seems like a very easy thing to accommodate.
I still remember like when my sister was born, looking through the glass into the nursery.
really?
Yeah, in South Africa, but
Oh.
yeah.
Okay.
Yeah, because they hire people to carry the babies, right? Like to hold the babies. Although they might be there.
Oh, you're
for
talking
other
about when I
reasons.
was in the NICU?
Yeah. Right. Well, that's different.
Well, that's
NICU.
different. That's like a preemie.
But they would still take the babies to like a nursery, right, of some sort, if they're not with the parents. That's what you were talking about. When Michaela was born.
When Michaela was born.
Yeah.
Yeah. I don't know what they did to get them there, probably.
Yeah, and you know, again, adapting to circumstance. If something were to happen and Janine were to need to be separated, like let's say that she did need an emergency C-section, sometimes they'll practice kangaroo care. Well, Dan might be able to do skin to skin with her, which may not be quite as good as Janine doing it, but it's the next best thing. It's you're bonding with your baby. They're getting the warmth of your skin. It's a much easier transition. So that'd be a question for the hospital, like, what do they do in the case of emergency C-section? Like, they're probably going to take the baby off, and they're, like they always do, they're going to do their APGAR scores, they're going to look at their color, they're going to look at their breathing, and then what? If you're unavailable, like, will they let Dan get in the hospital gown and do it?
That's a good question.
Yeah, so these types of questions, I should have asked this earlier. You typically go over this with the doctor that you're seeing, or can you just call them and ask, like, the front desk if you have these types of questions?
I wouldn't ask the front desk.
Okay.
I mean,
They're
you
so
know,
rude most of the time.
are they?
Yeah,
Well, I mean, you
sometimes.
can't always predict who you're gonna get, but.
Because you'd have to, otherwise you'd have to like make an appointment with, maybe choose a few different hospitals, make an appointment with each one, and then ask those questions. Is that typically how it's done?
Yeah, that would be tedious. I see what you're asking. I mean, right now you're set up with care at Lincoln Hall, and so Dr. Bailey, you said?
Yeah.
I mean, next time you're in an appointment with Dr. Bailey, these are things to go over with him. It's set out your goals and see how he responds. Make a decision of whether or not Dr. Bailey is right for you. And if you decide he's not, you start doing your research. You know, ask people connected in the birth community, and then try to establish care at another practice. And it's kind of tedious to go through that, but I think that if one provider ends up not being the right choice for you, you kind of already have begun to figure out what your desires and wishes are. It's going to be a little bit easier to find that specifically, because you're going to be looking for the provider that meets your beliefs.
Yeah, that makes sense. Yeah, and it is helpful to have people who are in the know as well on the inside too.
Yeah, I wish I was more. I wish I knew, but I'm starting to meet other doulas around here that are giving me a lot more guidance.
Yeah.
That's cool.
Yeah, that is helpful.
Yeah.
Expanded your network.
Yeah, it's definitely necessary. So yeah, I know that's a lot. We're gonna play a little game in a moment. Once I go back through the stages, we're gonna play a little game called "What Stage Is It?" And I'm gonna get you guys to go through some case studies to see if you can recognize what stage of labor. But first, I think we're at the point we need to stand up. We need to move a little bit, and we need to do a fun activity. So, how am I doing on time, by the way?
Looks like 8:15.
Okay. All right. I want everybody to take a ping pong ball to reinforce what we've already taught about the stages of labor. Okay, stretch your balloon out a little bit. This is like the cheesiest demonstration, but I do it because it's a great, especially in classes where everybody's nervous. Like,
Is this the baby? I need to put a face on it if it is.
oh yes, it's the baby. Put a face on that ping pong ball. All right, so carefully try to put your ping pong ball in the balloon
Without ripping it.
without ripping it. If you're a bit, I'll put another one for you, but.
Ooh. I allow you to do it.
You can tell I've had some practice.
Wow, you can actually do it.
Oh no, it ripped.
Janine.
Maybe I was trying to do it a different way.
If it gets any kind of tear, you might need another one.
If it has a
Oh, I think Dan's about got it. Okay, great.
Yeah, like that. Come on.
Right now it's in the cervix. Need to get it further.
No, it's okay. So you can blow it up. So
Oh, okay.
maybe help out your wife.
Oh. Did you pop the ball?
I was blowing
Oh.
it.
That is not how we want birth to go.
One more, here we go.
I'm not usually having this much trouble. It might be these cheap dollar store balloons.
What if we blow it up first? Can make it
I've never had success that way, but good luck.
really.
Okay, Dan, hold on. I'm gonna help you out.
Alright.
I got that. Does that count? Or is
Yeah,
it supposed to be
yeah,
all
yeah.
the way up here?
No. It's like that, and then you start to blow it, and the balloon will drop a little bit.
Oh,
And,
that's cool.
Don't blow too hard like I did.
What? Is it supposed to go?
Or maybe just keep trying to push it.
Okay, look how well I got this. Okay.
Oh, look at that. Alright, thank you.
Okay.
So we're blowing it up as well.
Okay. Got it.
Okay, so you blow it up. So about, it's gonna be like our uterus here.
Okay, take this side.
Things.
Okay, don't tie it. Don't tie it.
Okay.
Because you don't want a knot in that cervix, do you? Okay. What you're gonna do is you're gonna balance the ping pong ball over the entrance, like that.
Like blocks it. That's
Yeah,
so
I hope this will work. You got a little bit of small uterus there, but it'll work. Okay. Now, Dan, Janine's not gonna answer this because I know she already knows this. What is this called?
This cervix.
The cervix. Very good. What is this called?
This is the amniotic sac. Is that what it's
Yeah,
called?
or the womb, or the,
Okay.
the uterus. Yeah.
Uterus,
So
yes.
the amniotic sac is like inside the uterus. You know, there's
Okay.
multiple muscle layers there, but yes, we've got uterus here. Baby is your ping pong ball, and here we got the cervix. Is this a woman in labor yet?
This is pre-labor, right?
Maybe.
Okay.
Okay. The cervix is pretty soft. Now we're not going to take this analogy too far.
Okay.
But this is just to demonstrate dilation and effacement, basically. So when you have Braxton Hicks contractions, notice. Okay, when you have the uterus, there are horizontal muscle fibers and longitudinal muscle fibers. Okay, different layers of muscle fibers. A contraction is really nothing more than a muscle contraction, right? Like when I do this with my muscle is contracting. That's exactly what is happening when you go into labor. Your uterus is involuntarily contracting. Now, a Braxton contraction, they're kind of uncoordinated. They don't actually create dilation or effacement because the muscles aren't really working together, those muscle fibers. But what they do is they serve the purpose of strengthening the uterus. The muscles are getting stronger through those Braxton contractions. There's a purpose. But when real labor contractions happen, the fundus, or the top of the cervix, that's where that contraction starts. And now I want you to put your hands on here, and I want you to squeeze from the top down, like this. Okay? So we're in essence taking those longitudinal fibers and shortening them. Okay? And as those muscle fibers shorten and the contraction starts from the top down, notice what's happening to the cervix. The cervix is getting smaller, right?
Mm-hmm.
Dilation is not really happening yet, but the cervix is effacing.
Oh, I see. That's so cool.
Okay. Okay, and now it's labor. It's really strong. Oh, push, 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 push. Oh, woo! Push that baby out. And that is not how your second stage will go.
Our baby's not gonna blow out.
I love to do that with my South African ladies because it always like to talk about the vagina or the uterus or whatever it was like. So we had to lighten the mood somehow.
That is fun.
And we have another game we're gonna play called What Stage Is It? But I'm trying to think, should I go over the what to do? I want to go back through the stages one more time, really familiarize yourself with those stages of labor we talked about. Then we'll play a game called What Stage Is It?
Okay.
Okay. And if we have time today, we'll talk a little bit more about like routine interventions and procedures, like fetal monitoring, different methods of induction, stuff like that. If we don't get time to cover this today, then we'll cover it next week. Okay?
Sounds good.
So, pre-labor. What is pre-labor? Look at your cheat sheet.
Braxton Hicks happens. The irregular contractions.
Regular contractions. Loose plug.
Mhm.
Ripening and effacement.
Very good, very good. We've said, you might be feeling anxious or nervous. The biggest mistake that women make, I think, is getting really anxious at this stage, like hurrying your body along. What do you think a woman should be doing during pre-labor?
Like moving around more?
Yeah, move around, take a walk. Should she focus on it?
No, I was gonna say that not to think about it. Try not to think about it.
Distraction, distraction, distraction. Go about your normal activities. If it's pre-labor, who knows when labor's going to start? We don't know when labor's going to start. So keep working as long as your work, which I know is not strenuous. So do your normal activities. Make a meal, go for a walk. Make sure you're drinking plenty of water and getting rest. That would be just knowing that you're gearing up for this athletic event, just doing really good self-care. Now in early labor, when things start to pick up, you might start to feel a little bit more anxious. So, okay, ooh, now things are really getting going. What's it going to be like? I'm afraid of the contractions. I feel it a little bit more. I remember I started to cry a little bit at this stage just out of anxiety. What do you think you should do at this stage?
I guess make sure your things are ready. Making sure your bag is packed. Is that too early?
No, I would say you probably need to have done that
before. A while
like
ago.
a while ago,
Okay.
like pre-labor, before pre-labor, have that bag packed.
Okay.
Yeah.
Make
You
a-
probably felt the urge to nest.
Eat.
That's what we were saying. Make a big thing of pasta.
Yes. You guys like pasta?
Sure, we'll make it.
Yes. At this stage, again, don't get too mentally anxious. A lot of women go to the hospital in early labor because they're like ready for it to move along and they're excited, but they might overestimate those contractions, only to feel discouraged when you find out you're 1 centimeter long and gets at home. It can be discouraging. It can even, just the upset of driving to the hospital and back can stop labor for a while. So the idea is distract yourself as long as possible. Like when you're in active labor, you'll know it. There's no distraction. But yeah, don't get too focused on it too quickly. I mean, great ideas of things to do would be spend time together and watch a movie, go for a walk. You've probably already been in the nesting stage and had things ready at this point. You don't want to exhaust yourself. But yeah, if you feel like, doing a little bit of work here and there to prepare for the baby, you can. You can continue to go about normal activities until you feel like you can't, as long as you're getting rest, as long as you're eating well, because you don't want to go into active labor already exhausted. So I remember when my childbirth educator told me, it was like, eat and sleep, like at night, like in early labor, get sleep. It can be kind of difficult because now, as we said, contractions are picking up. It can be hard to sleep, and what she said was, drink a glass of wine and take 2 Benadryls. That is not what I'm telling you to do, to be clear. But the idea behind it is like, make sure you get rest.
Yeah.
Because really you're preparing for the athletic event, but just try to distract yourself. And somewhere in early labor, you begin to get more serious. Before you get to active labor, it begins to pick up a little bit. It's a progression. And as long as you can, distract. Like Dan, you will know when you'll gauge things by her face, how she looks, how she's coping. If she wants to talk and be chatty and joke with you, then be that way for her. If she's getting serious, mirror her. Be quiet when she needs you to be quiet, that kind of thing.
You're naturally quiet, so you're like, no problem.
No problem. I can do that.
Yeah, so get rest, eat food, try to take it easy, and as you get into active labor then will be the time to go to the hospital. So usually as we get into active labor, that's like 5 centimeters, 6 centimeters on, that's when you're really going to start to need your comfort measures that we'll talk about next week. There's a lot of things you can be doing. You can be bouncing on a birth ball and doing some different positions in early labor, but you don't want to be too focused on it, because if you're like trying to just really focus on the labor, it's almost like you're trying to rush it along. And it is a mind game. It is, the more you relax, the more the oxytocin will flow. And the quicker that the contractions will pick up. As you can imagine, adrenaline and norepinephrine, like our stress hormones, what do you think happens to oxytocin when our stress hormones increase?
Is it a negative feedback then?
Yeah. It's the opposite of the positive feedback. So it's going to kind of dampen out the body's ability to produce and register that oxytocin. So that's why some women, when they get in the car to go to the hospital and they're stuck in traffic, those contractions quit. And this is kind of amazing, right? Because think about if you were to be in a jungle somewhere and a lion were coming to eat you and you were in labor, your body has this ability to say, well, can't be in labor right now. I've got to get to a safe place,
Right.
and to stop and turn off that labor. So that's all the more reason to make sure that in early labor, you're quiet, you're restful, you're in a good mental space, you're not stressed. And trying to make that transition to the hospital as seamless as possible, so that it's not stressful. If you go late enough, like you're in active labor when you go into the hospital and labor is really firmly established, it's not going to stop. But if you go too early where, maybe you're just a few centimeters along, it could slow down. And then you can pick it back up by, again, positive feedback, being very calm, being restful, getting in the zone and not being distracted. So even if you do have a hiccup in the road and labor slows down, that's not the end of the world. That happens all the time. But you know what to do to kind of cope and kind of pick up your focus again. Yeah. So any questions so far? What to do in early labor? Active labor. How do we know the difference between early labor and active labor?
Contractions and a dilation.
So it's a lot more, the contractions are a lot more frequent
Yeah.
Uh-huh.
And longer.
and longer.
And more intense. So what should you be doing in active labor?
Into the hospital.
Yep. What else? Alright, let's say you're already in the hospital. What do you do?
Well, I would still think you should try to stay calm,
Mm-hmm.
because is probably gonna take a while.
Mhm.
Drink water? Is it too late?
No, you can always drink water. In fact, you might not feel like drinking water, and Dan, I was gonna say, there's a few things that you can do. Okay, I'm gonna get there. There's a few things that Dan can do to help you. But this is the time for comfort measures, like you said, relaxation, and we'll talk about positioning, we'll talk about breathing, we'll talk about some non-drug type pain relief things that you can do. You're gonna be quiet and serious, and yeah, this is the game is on at this point. And this is when, Dan, your job really starts. This is when you really start supporting her. Right now, up to this point, you've been a great distraction, but now she really needs your support. She might need encouragement. She might need you to help remind her to take it one contraction at a time. When she's getting scared and she thinks, this is gonna go on forever, I don't think I can do it, you say, you are doing it. Let's do one more together. And you can remind her to breathe. One of the things I want you to do, Dan, is to monitor her body language and see if you see muscle tension. Like, let's say Janine, like, she's contracting and she's raising up her shoulders, then you can go and you can put your hand on her shoulder and you can remind her, relax, release that tension. You see her clenching her jaw, either tell her or put your hand on her face to remind her to relax. The idea is, in this stage, is full body relaxation. You try to not fight the contractions, because as you can imagine, like, if you're fighting the contraction, then what you're really doing is you're fighting your body's ability to have that contraction where those muscle fibers pull up and open the cervix. So breathing through that contraction, not fighting it, and it allows it to happen faster and smoother. And so then it becomes your job, Dan, to help her in that process by reminding her to take it one at a time. Also remind her to, and I'll make a cheat sheet too. So like Chris was like, it would have been so helpful for me if someone had just given me a cheat sheet that said, remind her to drink water, remind her to do this. No, I'll just make you a cheat sheet. But hand her, and I'm speaking to you like as if you were the doula too, because there's probably not going to be a doula in the room with her. Have a cup of water or juice or anything that you like to drink, and with a straw, because she's not going to be able to she's not going to want to have to hold it to her mouth. So hold the straw to her, and just in between contractions, give her sips of water so she doesn't get dehydrated. Remind her at least every hour, to go sit on the toilet and use the bathroom. There's not like a firm time limit with this, but you don't want to hold in urine, because as the bladder fills up, it can make that second stage longer. It can kind of hinder the pushing stage. So she needs to empty her bladder. She's probably not going to feel like it, so you can just remind her, you want to go sit on the toilet? You're going to remind her to change positions. You're going to remind her to use all the comfort things that we'll go over as she needs. And her instinct at this point is going to be really amazing, because you can plan all of the coping things you want to use, but when you're in the moment, I really think that there's something just innate in us that finds when you're focused and you're calm and you're not afraid, you find your rhythm and you're able to breathe through it. So you're going to be a support. You might be counting or rocking with her or making funny noises with her, but you're going to this is the time that she most needs your support. And just remind her to drink water and use the bathroom.
Do people typically do other things while they're waiting, like reading a book or watching something, or is that not you don't have any capacity to do anything like that?
Well, if she says, Dan, go away, I want to be alone, do it. Otherwise,
well, I meant together, yeah. I mean, I don't know.
She will be focused.
Okay, gotcha.
In between contractions, she will be resting,
yeah.
and just trying to relax. She at this point probably won't want to eat. She will not want to watch TV.
Mhm.
Every other noise around her will become very annoying. And 2 nurses talking in the other room, if she can hear it, will be very annoying.
Yeah.
And your job is to create the relaxing environment that she needs. If you're in a teaching hospital and residents are coming in and want to take a look at her, you're the one's like, my wife wants privacy. And you're gonna ask
the problem
her.
with Philly.
Are they all teaching hospitals?
So many, yeah. Like I even felt bad as a nursing student asking, you know, the same patient the same questions. With the nursing students come in, the PA students, the med students. It's
Yeah.
like, I don't know.
But it's like in our teaching hospital.
Yeah.
Is it, did they send people there for rotations?
Well, I can't speak into that particular hospital. What I can say, Dan, is that one of your jobs is to advocate for her because she won't be able. She may, or she may not be able to advocate for herself.
Mhm.
She might not be able to talk. It's that intense, and that's okay. And that's when you are the one that says, my wife wants privacy. And you have these birth preferences ahead of time, which kind of help you. You'll be able to look at her and gauge her needs. And so just, you know, if it's a question, but she just can't verbalize it to the doctor, it now becomes your job to be able to talk to the doctor, to ask that question, you know. That maybe they're wanting to speed things up, and she's focused, she's coping really well, she's, you know, and you're like, what's happening? Why are they trying to speed things up? You know that she doesn't want unnecessary, you know, unnecessary procedures. You can advocate. So this is Dan's time to shine.
Right.
But Janina's doing all the work, and it is work. You know, it does not have to be suffering, because you know what's happening, but it's work.
Yeah.
I would not read a book.
Right. No, well, not myself. Just for her to have to relax herself.
Oh, you mean, can she relax?
I wouldn't be able to. I wouldn't really.
Janine's over here focusing, and Dan's like watching his iPad. I don't think
What's
you
the
do that.
next episode of what's so-and-so?
You follow her. She
Yeah.
feels like watching, you watch with her. She
Mhm.
feels like focusing, you sit and you focus with her. And again, that's where doula can be helpful, because it can be long. You know, that can go on for hours, and you forget to eat and you forget to drink water. Then you're no good to her.
Mhm.
You know. So there are times that you may need to step away and take care of yourself. Make sure that in that birth bag you don't only pack snacks for Janine, you also pack snacks for you.
Mhm.
And that when you need, you take permission to just go take a second. Having a second support person, I don't know if they'll allow this. Will they allow somebody to like swap, so there's only one person in the room at the time? Or they only allow one person in the hospital?
I don't know. I've heard that with COVID, a lot of times you just have to stay there until like the lady gives birth.
Yeah, that's what
I've heard that too.
some of our friends.
But I don't know. Like
I'm sure it depends on the
we're
hospital.
probably adapting now.
Yeah, like they don't
Yeah.
let you leave the hospital.
That's what Nate did.
I don't know about Nate and Hope, but one of our other friends, Kyle and Kyle was saying that. That was towards the beginning of COVID.
Yeah.
So with that, you know, make sure that you pack maybe a pillow for you, and food, change of clothes, everything that you need also, and just make sure. It's pretty, it's intense not just for her, it's also intense for you, and so making sure that you're able to take care of your needs. Because I can imagine it's hard if you leave the hospital and you can't come back, but you need to rest, so.
Yeah, you won't be able to rest. Yes.
At that point, you won't be resting. Yeah, except in between contractions. And it's interesting because once you get to transition, you really can you can be so tired that you will fall asleep in between contractions, which is, you might have a 30-second rest between contractions, and you will literally fall asleep between it
Wow.
to be woken up. It's like this, like, almost state of just unconsciousness, like, it comes and it goes. But it's, again, that stage is not long.
That's good.
Yeah. And that, honestly, that if you're in the zone, that means you're doing great. That means you are relaxing. By the time that you progress to about 8 centimeters and you're in transition, at this point you've been doing lots of comfort measures. You might be counting or rocking or swaying and be very focused. you lose your rhythm. Suddenly, resting between contractions becomes impossible as the contractions become closer and closer together. And that's when Dan, at this point, telling her to relax her jaw or relax her shoulders is no longer
Yeah.
no longer
Not
what you do,
possible. Mhm.
because you see that she can't help it.
Mhm.
Now you see that you remind her, great, we're almost done.
Mhm.
Like, this looks like transition, we're almost done. And just encourage her every time. And it's still at this point, as the contractions become more and more intense, remind her to take them one at a time.
Mhm.
Have her try to breathe through it, but right before you push, your body just kind of takes over. You can't really fight it or relax through it. You're just getting through it. And then pushing. So just try to help her keep her center. Remind her to take one at a time. Yeah, if she's fearful in any way, be sensitive to that. And, and just give her great encouragement. And it's great for you guys to communicate now how you think this might be, Janine. Like, are you one of those people that when you're in pain, you want to be touched? Like, do you want to be massaged? Or are you one of those people that's like, hands off?
I don't know. Am
When you're in pain?
I? Yeah. Maybe I am.
I don't think it bothers you to be touched.
You'll probably be able to tell him in active labor,
Yeah.
massage my back, or can you play with my hair, or like, can you stroke my leg, or whatever it is. Or you might feel, don't touch me. And just follow her cues. She can communicate with you, at what, or maybe even she can't say it. She'll be able to communicate with you in some way, whether or not she wants to be touched. So you're able to gauge how to support her when she's in that kind of pain.
Yeah. Either way, you won't be offended.
No offense.
So that'll really
No offense.
make me feel better.
And the nurses will be coming in to check on her progression, I guess, throughout this time, right?
Yeah. It kind of depends on like your provider,
Uh-huh.
but every so often they'll come in and they'll do a vaginal exam,
Okay.
and they'll check your dilation. You don't want them to do it too often.
Mhm.
What do you think is the problem with doing it too often? Infection, yeah, that's one.
An invasion of privacy.
Yeah. Yeah, it's invasion of privacy. You're so focused and relaxed, and now you've got to get on your back and open your legs, and it's very uncomfortable. You can imagine it just kind of upsets your rhythm, it upsets your calm. And it can also be discouraging. If you think that you're farther along than you are, and then you're told you're 3 centimeters, but you thought you were in active labor, what are you going to feel?
Yeah, that's true.
Sometimes it doesn't always help to know where you are. But the thing is that centimeters don't really tell us as much. That's what medical providers go off of, but they honestly don't tell us as much as how you're acting. Like, I have been told that someone was 4 centimeters to have them give birth 30 minutes later.
Wow.
And because, she was acting in, I don't really actually know about that situation. I'm not sure, maybe dilation wasn't checked correctly, but the point is to go off more of what you're experiencing, knowing the signs, and knowing it can happen quickly. Just because you find out that you're 3 centimeters, it is discouraging when you think you're further along than you are. But you can tell yourself, that doesn't mean that this is still going to last 12 more hours. It's not, just because it went really slowly at the start, doesn't mean that it's going to go slowly at the finish. Your body may have been doing all the necessary things up to that point to help you produce more blood, to all the hormonal stuff that's going on, and it's preparing, and when you get there and it's ready, it goes. So knowing that helps you fight discouragement, because when you're discouraged, then you're feeding yourself fear and defeating thoughts, and now we're back to the fear, pain, tension cycle. So it really, I can't stress enough, it is a mind game.
Yeah, it sounds like a mind battle. Inception.
Yeah, so when you're in transition, again, like I'm just preparing Dan because this will be the part where I feel like Dan may feel most overwhelmed and not know how to support you. It's just really good for Dan, both of you, especially Dan, to know what to expect. She might scream, she might cry out, she might vomit, she might lose her rhythm, and that's, again, you just gotta be so calm. You are the rock.
Yes.
No matter what you see or how much you're freaking out on the inside, take a deep breath and know she's doing great.
Yes.
This is what it is. This means that her body is doing everything it's supposed to do.
Alright.
Pep talk.
I'll try it. That's what I'll do.
You'll do well.
I know, you have a very
Yeah,
calm
Do you have
personality.
a conference?
I have the same as Chris. What is it?
Oh, the Enneagram.
Are you an INFP?
No, I'm ISFJ.
Oh, okay.
But we have the same Enneagram number.
Oh, no, Myers-Briggs Enneagram
Yeah.
with 9s.
9,
Yeah.
that's right.
Calm. Yeah, I have no doubt that you'll do great, both of you.
Yeah, well, it's probably similar to, like you said, marathon too, which Dean has run, so it's,
We'll see.
I mean, it's, well,
Like it's another ball game.
yeah, but I feel like you're a mentally tough person, so.
Yeah, I really think that every woman has, stuff happens. High-risk situations happen, C-sections happen, again, they say parts. But I think that most women have the ability to have natural labor. And I think that it's fear telling women they can't do it. When you actually know what's happening and you know, oh, actually the pain is creating that positive feedback system, it helps. It helps. Like your body is made to do this. Okay, so let's stand up for just a minute. And now I'm going to stop doing so much talking. And I want, all right, Janine, you pull the first paper and you read a scenario.
Oh, that's me. Joanna's contractions began around 3 a.m. and it's now 7 a.m. She's tired, frustrated, and feels that it will never end. Her contractions are irregular and lasting 30 seconds long. To distract her from the contractions, she carries on a conversation with her husband.
All right, so I want you to tell me what stage is it, and then what should she do?
Well, it's irregular contractions, so pre-labor, and she should continue the conversation.
So she feels tired and overwhelmed. Why do you think she feels tired and overwhelmed?
Well, it could last, like you said, weeks. You just don't know.
Maybe she didn't take birthing classes like you guys. She thinks
Yeah.
that those are real contractions.
Yeah, she doesn't know what to expect.
Alright.
Read it just a little bit louder so they can hear it.
Alright, Susie's contractions began around 5 a.m. They weren't strong, but they were regular. Now it's 11:30 a.m., and contractions are coming every 5 minutes, lasting for 45 to 60 seconds. She is quiet, focused, and doesn't want to talk much. So this sounds like active. Yeah, definitely active. It's the active period. Every 5 minutes. She's quiet, focused, and doesn't want to talk much, so.
So what can Susie be doing right now?
Susie should be trying to stay calm and trying to practice the comfort measures that she planned.
Very
And
good.
yes, telling her husband what she needs.
Very good.
Lily's contractions are coming every 4 minutes and lasting about over a minute. Lily is feeling cold and shaky and feels like she might vomit. She's not coping well and she wants an epidural. It sounds like transition, because Yeah, she feels like she's gonna vomit and shaky, and she's not. She wants the epidural.
Yeah. Now she might want the epidural in active labor, and that's her choice.
Yeah.
But if she's been coping wonderfully up to this point,
Okay.
let's transition. So what should she do?
Just keep pushing through it and like go for instincts.
Yeah, exactly.
And her husband will tell
Knowing
her
that
that
it's short.
it's too late for the epidural now.
Sorry.
Yeah.
Gotta
It's
keep
It's
going.
almost over.
Yes, and it's almost over.
Very good. One contraction at a time.
Yes. Alright, Pam's contractions were very intense, but now they are less frequent. She was told that she was 10 centimeters and can now push, but she doesn't yet feel the urge. At first she felt such relief, but now she is worried the baby isn't coming. She feels panicky, and the midwife told her to just breathe calmly. So this is definitely pushing. Well, getting there. Probably in between transition and pushing, I would
Mhm.
guess. Well, it's during pushing, yeah. But she's not actually pushing.
So she's in that like resting phase.
Resting.
Short resting phase between pushing.
Yes. So she shouldn't feel worried. Her body will tell her when is the right time to push.
Correct.
And
You're such a
Yeah.
good student.
Dan, are you a straight A student?
no, I wasn't actually. I was a shit. Well, you're such a good teacher, that's why.
You are. Erin's contractions began very slowly in the afternoon. Now they are 8 minutes apart, lasting about 45 seconds. She can speak in between contractions, but during contractions she's focused and serious. Is this early? No. Active.
Read it one more time.
Erin's contractions began very slowly in the afternoon. They're 8 minutes apart, lasting around 45 seconds. Yeah, so that'd be early, I think. She can speak in between contractions, but during contractions is focused and serious. Yeah.
Very good. Yeah, early labor. So what should she be doing?
Resting, eating, and yeah, trying to relax. Like not go to the hospital yet. So.
Yeah.
Carb load.
Yeah. She may need to, breathe through the contraction when it comes, but she doesn't need to focus too much on it.
Alright, Marcy calls her husband home from work. Her water is broken and she's very nervous. She feels excited and panicky. Her contractions are 20 to 30 minutes apart, but not very painful. She wonders if she should go ahead and go to the hospital. No, Marcy, you're in the pre-labor phase.
No mercy.
Yeah, pre-labor.
And does that happen like right after the bloody show, the water break?
So that's a good question. When does water break? In
Yeah,
the
that's-
movies, water breaks before you, like right as you go into labor, and then it happens.
Go to the hospital.
Okay, I'm sorry to say that's not usually how it happens. Only 10% of women actually, their water breaks before labor. Most women have their water break around 8 to 10 centimeters.
Oh wow.
Yeah.
Oh, really?
Yeah, sometimes the water can break before and sometimes it can leak. So there can be a small tear in the amniotic sac and you might notice just a little bit, you're like, is this discharge or is this water? But it continues. And if that happens, what you do is you call your provider and let them know. They may need to test it to see if it's fluid, if it's amniotic fluid. Because once, it's still considered your water breaking. Once your water breaks in whatever fashion, you're then on the clock. They need you to go into labor within 48 hours. And some providers have different time limits, but like that's probably what WHO says. It's like, okay, 48 hours to prevent infection. They're not going to let several days go by if water has broken. Now, your body is always replacing the amniotic fluid. The baby is never in a dry environment, even after the water breaks. Like, baby is safe. but the risk of infection after a prolonged period of time can increase.
Hmm.
So that's why they will, if you haven't gone into labor, they might induce you. So we can
Okay.
talk about different types of induction methods in a little bit, but it's a really great question, is does water break? And it's maybe Jonah's favorite new phrase, maybe yes, maybe no.
Really? That is cute.
I was going to say that.
So then in this case, Marcy should, I guess, call her doctor,
Yeah.
but maybe go to the hospital.
Now, Marcy should call her doctor. If her doctor says, you need to come in, you are a high-risk case, she listens to her provider. Her
Okay.
doctor might say, all right, we'll give it this amount of time. Go bounce on a birth ball, go take a walk, try to get labor started naturally.
Hmm.
So it kind of depends on her situation. And there, if she has any factors like high blood pressure, gestational diabetes, they're going to have her go ahead and go in
Mhm.
because then she's a little bit more high risk. But typically, you would just let your provider know and then possibly stay at home. Or they might ask you to come in. It really depends on your provider on that one.
Okay.
Always call your provider if the water breaks.
But it's only 10%, you said, of women.
With 10%, it breaks fully breaks with a gush before labor starts.
Okay.
It can break at any point in
Okay.
labor.
Okay, so that's really not an indication.
No.
Okay.
But you do know this, that it breaks because the pressure, it breaks because your body's getting ready.
Mhm.
And most of the time, when it breaks, labor's about to start.
Mhm.
That's another signal of pre-labor.
Mhm.
Even if it's just leaking, it's another signal of pre-labor.
Okay.
If it's a very, very small tear, your body can kind of repair it and it will stop, but I think that it's less common. That's actually a question I'm gonna look up.
Huh.
So always, in those situations, always call your provider.
Okay.
And now, that brings up another question. I said to go to the hospital in active labor, but there's actually a rule. I think I put the rule, but you might want to write this in your notes. We call it the 4-1-1 rule.
Mm.
Okay, so when do you go to the hospital? 4-1-1. Okay, Dan, I want you to remember this. Say it with me. 4-1-1. Now, what this means is contractions are 4 minutes apart. So we'll talk about how to time them in just a minute. Contractions are 4 minutes apart, 1 minute long, and this goes on for an hour.
Wow.
Hmm.
Again, the best thing you can do is wait as long as possible to go to the hospital, because then labor's established. It's not gonna slow down, or it might slow down a little bit, but it's not going to stop with all the transition and the upset. And also, because then once you get in, now you might have more restrictions. You might you're gonna probably need to get in a HEP block, put in an IV. If you're strep B positive, they're gonna give you antibiotics. There's things that they do and so wait as long as possible, but also trust your instincts. You may know if something is wrong. You may feel weird or have a fear, and so it's always okay to call and talk to your provider about it. If you really feel that something is wrong, like let's say you're bleeding, then you'll go sooner.
Yeah.
But this is like labor's progressing as normal, everything seems fine, you've prepared yourself. 4-1-1. So 4 minutes apart, 1 minute long, for 1 hour.
And then, based on that, is that, how long do you have to get to the hospital? Or how, because,
So-
distance-wise, what do people recommend?
So some people would say 5-1-1, some people would say 4-1-1.
Okay.
So if it's 5-1-1, you're probably gonna be around 4 centimeters when you get there, just as a very general rule. If you wait a little bit longer till it's 4-1-1, you're probably gonna be around 5 to 6 centimeters where you're actually in active labor. So you've still got plenty of time.
Okay.
You don't feel like walking, it's annoying at that point to transition, but to have to move environments. But unless you're a very quick birther, you still got plenty of time.
And first time takes longer, right?
It does, yeah. Yeah, you probably still got several hours. That being said, some people, even first-time moms, have lightning births. We call it the precipitous birth. It's not super common, but it can happen. And those births can be really intense. So, actually, instead of just putting it on that, I'll just write it on a piece of paper. Write on the back of this. How to time contractions, because this is pretty important. You know when to go to the hospital by
You can write it here, because I put the 411 there.
Okay. Do it then.
Yeah.
So let's say a contraction, it looks like a peak, right? The pain begins, it peaks, and then it goes down. Then it doesn't happen for a while, and then it peaks, it goes up, and you'll feel it going up and you'll feel it going down. You time a contraction from the start of one to the start of the next. This is the time between contractions. So the time between, it does include the contraction. The duration of the contraction is, of course, this is the duration. From the time you feel it to the time you stop feeling it is how long that contraction lasts. So, this may be 30 seconds, this may be 90 seconds, depending on where you're at in your labor. But this is the time between. Now, one nice thing about living in our techie world is there's apps.
Oh.
You download an app, and then if you're wondering if it's time to go to the hospital, just time a few, and then monitor her. You don't need to sit there during the whole labor timing contractions, because it's just distracting and not helpful. But every now and then, if you're trying to kind of gauge progress and see if it's time to go to the hospital, get that app out and begin to measure her contractions. Because you know these general guides, right? 30 to 45 seconds in early labor, 60 seconds, 60 to 90 seconds in transition. And this is what we're talking about. The start of one to the start of the next. And the duration. And this cycle has to go on for an hour or so.
Oh, right.
Alright, thanks.
Mm-hmm.
So you'll be measuring it for the whole hour. Yeah. Okay. That makes sense.
Maybe. I mean,
Or not. Yeah.
you might,
Not very.
maybe you measure for a few minutes, but then you just kind of monitor and you see that pattern continues.
Mm-hmm.
You'll know.
Okay.
If you want to measure the whole hour, it's fine. Or she may need your support in other ways.
Yeah. We'll make a little scientific experiment. What did you need? Stopwatch.
And she can probably do that too, like have this app where all she has to do is when she starts to feel it, because here's the thing, yeah, you just tap it, and when it's over you tap it, and when it starts you tap it. Because you might not know, because it might not, when she's beginning to feel that contraction, she's not necessarily going to express it on her face or her body language until it gets to like the more intense part. So it's probably more helpful if she taps.
Right. All the time.
There's an app for everything.
I know.
Isn't it great?
That's helpful for one.
Yeah, so this is like drinking water through a fire hydrant, isn't it?
It's a lot of information. Yeah.
Well, if you like, we can save the routine procedures and interventions. I have a few more minutes if you want to go over some of those things now. How are you guys feeling? Do we need to quit for tonight, or?
I mean, it depends like how much material you wanted to cover. Like if you wanted to cover it briefly, I think we'd be fine.
You good? We're in the zone. We're
Yeah,
okay.
I'm a little tired, but.
Well, the things that I have left to cover, which we can easily cover next time in more depth, are fetal monitoring, types of inductions, different pain relief medications, so you're aware of what your options are, epidurals, pros and cons of epidurals, just if you're considering that as a possible decision. And and then then after that, we'll get into comfort measures. So.
Okay.
Sounds good.
Yeah, that's, I didn't know much about that, so that'll be good to go over.
Yeah.
So,
Great.
yeah, we can save it for next time, I guess.
Okay. Yeah, and also, like I said, we can touch on it now, and we can go over it closer to the date when you're really in the zone that like you're really having to, especially comfort measures,
Okay.
and you want to talk about it when it's closer to time that's going to happen. I think at this stage, probably the most important thing is kind of getting your feel for your decisions of a provider and
Yeah.
knowing what questions to ask.
Yeah.
Yeah, that's helpful. And like distance-wise to a hospital, is there like a recommended distance, like living close?
In an ideal world, the
An
shortest
ideal
as
world,
possible, but
right.
I mean,
In
people
Philly,
have.
it's like.
How far is your current hospital?
Lincoln was like 30 minutes during the day.
Mhm.
Yeah.
I mean, if it was heavy
If-
traffic, it'd be longer.
Yeah, then it would be more like 40 maybe.
You know, it
It's
may, if you see, for instance, that labor is progressing very fast, it may make a decision where you may go in before 411 because of the distance to the hospital. If you see this like progression, and again, a doula or somebody to ask for questions for that. There's no rule about it. Women have driven an hour or more in labor. But being said, it's not optimal.
Yeah.
It's annoying and it's frustrating.
Yeah.
Would it be worth it for you guys to have a hospital where you really feel supported and like it's the right choice? Maybe, because then it takes out so many of those other fears. So it really is a personal decision. And one thing I do recommend is whatever hospital you choose, drive it at different times of the day. So time yourself driving at night when there's no traffic, time yourself driving at rush hour, so that you can plan
Yeah.
what to expect.
Yeah, that's a good point. Yeah. I'll have to check out a few others maybe.
Yeah. I mean, the center city ones are annoying because of parking.
Oh my gosh, what do you do?
I mean, I think they do have garages, but it's expensive.
Yeah. For one time it wouldn't be too bad, I guess. But
Yeah, but a lot of their offices are there too. That's the issue.
for doctors.
So every doctor's visit, you'd have to go and
Go into the city, yeah, and figure that all out. Which is why the suburban/northeast is what I was looking at originally.
yeah.
Because there's just parking. It's so silly. Like it should be basic, but it's not.
Yeah.
Have you heard of any other hospitals that were recommended around here? You mentioned Einstein.
Einstein Montgomery.
Montgomery.
I mean, 276 is fast.
Yeah.
We could take that or 309.
Yeah.
I know Dina told me out of the what's the system that Lincoln Hall is part of? Mainline. She said they're four, right?
Yeah,
Four
did she
hospitals.
say Paoli is better?
No. Well, she said that Paoli and Lincoln Hall tend to be the highest of intervention rates,
That's
And-
so funny.
and Bella
Kinwood.
Kinwood, and the other one tend to be
Riddle and
Riddle.
Oh.
She recommended
Bryn
Riddle.
Mawr.
Bryn Mawr.
Dina, this is a question for you. Help me out here. Yeah, she said there's one doctor in particular. She said not that one, but
Okay.
yeah.
They're better.
I don't. I mean,
Maybe it's because they're so popular, they're more intervention based.
yeah. I mean, like it depends on what women want. Like a lot of women do want the epidural. They want a good anesthesiologist, and they like the rooming in, and they like the facility. So if that's what a woman's looking for, then Lincoln Hall's great. If you're looking for a more natural, friendly type birth, then it wouldn't be the place.
Yeah.
So, depending on your doctor, I don't know about that. So.
Yeah, that's true.
Yeah. Okay. Yeah, that's helpful.
I'm sorry, I wish I could be more help.
No, that was more than we knew, so
Yeah.
that's helpful.
I'm gonna ask around though, because I also need to familiarize myself with the hospitals around here.
Yeah.
Full. Okay, it is full.